This is Pat Salber with Health Innovation Media, and I'm here at CES 2014 in a very noisy exhibit hall with Dr. Samir Damani. And Samir, I understand you're a cardiologist, but you're also an entrepreneur and a technologist. Tell us about MDRevolution.
Sure. So, about 2 years ago, in my practice, I started bringing into my practice some of these tools that you see around here, the Withings blood pressure monitors, the scales, the Fitbits of the world, bringing it into my practice, and found that it helped a lot of my patients track what they're doing and place greater awareness in terms of when they needed to do something differently. So I'd have patients that would come in and think they're exercising, and they would send me their heart rate data, which would show their heart rate barely got above 100, and they realized that wasn't exercise, or physical activity. So what I realized, though, at that point is that there needed to be an ecosystem that physicians and healthcare teams could take the data from that information and coach people, and that the process by which the data was aggregated, because right now all these apps and these devices go to different apps, that needed to be integrated in some sort of fashion.
Right, you can't go to 7 different websites to try and figure out what you're doing.
You'll never be able to really get what you're trying to get, which is better outcomes in that manner. It has to scale, and what we're talking about is managing populations. You can't manage populations without the software to really aggregate the data, and then being able to have a healthcare team. And it doesn't have to be a physician. All the work that we do at MDRevolution is by nurses, metabolic specialists, health coaches, and a lot of it is about around eating right and exercising and increasing awareness. So we started MDRevolution 2 years ago in a clinical lab, and now we're launching RevUp to the consumer, RevUp Health Accelerated, which is our software platform, which is a subscription-based platform. And we also have an enterprise solution for companies that we've been delivering for quite some time. We have some big clients, health systems as clients, and but here at CES we're launching a consumer platform.
So you've had this product that's been out there for a while, not the consumer product.
Right.
How do you know this works? Have you done any clinical studies? Do you have any outcomes to show that not only do I take the steps, but I actually get some metabolic and or weight and or some other kind of health outcome from it?
Yeah, well, we have a clinical lab, an R&D lab, which we opened before we built the software. So we have over data on over 100 consecutive patients, which show approximately 70 to 80% of those improving in 3 categories: weight, visceral fat, body fat, and many of them improving cardiorespiratory fitness, or VO2. Plus, we also have our corporate customers, their data. We're seeing with our Sharp population, we took the highest risk people, so people with two plus risk factors, and what we're finding is that we're hitting about the same rate of success in terms of effective outcomes. So we're really on to something here, and now we're also entering a partnership with Harvard to do some validation studies as well. So we've got a lot of preliminary data. We're publishing some of it as we speak right now, and we have much more planned.
So you have customers, right?
Oh yeah, yeah.
Tell me what kind of customers you have. You mentioned it, but
corporate clients. So a lot of corporations you bring us on to use RevUp to help coach their employees. Self-funded corporations, but also health systems. Our biggest client is Sharp Healthcare right now. They're a $2.7 billion health system, and we did a pilot with them, and we're looking to expand that pilot going forward. So the idea is that this platform is about population health management. So anybody interested in managing the population, self-funded corporations, but wellness is a big concept out there, and right now it's been an industry that has lacked the scientific rigor that is present in medicine, and right now wellness companies are out there selling participation. So success for a wellness company is whether you can get people to just participate. So that's why you see health risk questionnaires and all this stuff, and they just assume that that will take to outcomes. We're trying to say we can track outcomes even in a corporate setting, and that data can be secure through this platform. We're a third-party platform. We do the coaching. We can also train them to do the coaching, but most of the people like us to actually do the coaching from a remote site based on the data and the algorithms in it. So it's secure, and so the companies really like it for their employees, and the employees love it too.
I'm interested in your partnership with Harvard. Are you going to go beyond the outcomes being I lost weight or I increased my cardiovascular fitness to I'm having fewer heart attacks, I'm having less angina, I'm having whatever,
Right.
I'm not developing diabetes?
Regarding our partnership, Partners Healthcare and the Center for Connected Health, we're talking about designing a study to actually address questions surrounding people reaching outcomes. In particular, the ones we look at are VO2, so V is volume or consumption, O2 is oxygen. It's people's heart and lung capacity. It's actually for many years been known to be one of the most powerful predictors of death, and in fact it's about 10 times more predictive of death than serum cholesterol in somebody who's just walking around who doesn't have existing coronary disease. We've ignored that in the medical system in many cases because it's not part of the medical system to actually improve and prevent disease in many situations. It's actually more important for us to actually treat it, right, at this current stage, but that's shifting with healthcare reform. The other thing we look at is body fat and visceral fat. So we use these surrogate endpoints, which can be changed by doing simple things like, walking, checking, paying attention to your weight, learning how to eat. Simple things that, we try to make too complex, but the reality, it's the simple things. These diseases, obesity, diabetes, prostate, lung, breast, colon cancer, these are diseases driven by visceral fat and inflammation, and these can be changed by eating right and exercise. The CDC states 80% of heart disease and 40% of cancer can be prevented, right? By simple things. So you're not going to cure a non-communicable disease that's driven by behavior with a pill. It's going to be done by using data, increasing awareness, educating, and accountability.
Well, I like to say diet and exercise are the blockbuster drug of the next century, and it sounds like that's exactly what you're working on. I just wanted to ask you a few more questions before we wrap up our time together. Tell me a little bit about the coaching, because one of the things we see with wellness programs is they often aim at the guy who would have done it anyway.
Yeah.
Right? So how are you getting at, or do you have an approach to try and engage the people who have been difficult to engage and the ones that are having the heart attacks and the diabetes and so forth and really need this kind of program?
Absolutely. In fact, when we were talking to Sharp, I told them, I said, we're actually not interested in the healthy people. We want you to give us your most unhealthy. So the ones with chronic disease, chronic risk factors, because I'm not in this game to make healthy. I'm a cardiologist, so I want to make, I want to make a dent in the chronic disease curve, whether it be the economic curve or the disease burden curve. So the idea is that our Sharp population were the highest risk, so they had to have 2+ risk factors come in. So the way we're doing it, and I'll show you, is the coaching works like this. So we have, and I'm just going to pull up our clinical dashboard. So you see we have many pages actually on the other dashboard. So let me actually show you one other page too before I go here. So you see the dashboard here, which looks at points earned. So we track points on a system-wide basis, so we can actually see when populations are not aggregating a certain amount of points, we can do interventions, right? We can raffle stuff off. We can give them incentives. We can do things like that because in real time we're getting data back on that. The other thing too is that they get to see all kinds of things like here's their nutrition page. They get a lot of stuff that is well, here's a health page.
The onion rings. I want some.
So here's the actual nutrition page, which gives some suggestions on what that person might benefit from in terms of diet. Then you have your health page, where you go to your health page, you can see that your trends in weight and body fat are all here, but then we also make your blood levels in easy to use format. You can see whether it's good or bad, and you kind of go, and we also do genetics data if the customer wants, so that's another thing. But what happens with the coaching, and in addressing your question, is that when we're going, a lot of people hear the statement, we're going from a doctor-centric to a patient-centric society, but they don't really know what that means. What it really means is...
They just think it sounds better.
It sounds better, but what it really means is you give patients all the data. You give the consumer the data, and all you have to do is see what is relevant in that data and let them know what's relevant and then coach them and increase accountability. So here what you see, and this is all internal people that have given a approval to use their health data. So for example, what you're seeing on our health alerts, we see now that somebody had 3 blood pressure readings above 130 over 85. So you can actually see now the blood pressure readings, and my team will just send them a message. So you hit send a message, and you can just say, please get your, or go see your doctor to have your BP evaluated. It appears to be high, okay? Simple messaging like that. Now, it basically closes the data loop, so it asks you to verify it, and then I'll send that message, and it goes. And then you can actually see, here's our message reminder. So here's the message I got. I got a reminder right here this morning. So it looks like I haven't logged any of my nutrition, right? So it creates accountability, because what we found is that if you just go through the process of actually tracking what you're doing and you get some coaching about it, it doesn't even feel like behavior change, because what you're doing is you're just increasing the person's awareness and you're giving some accountability by checking up on them. So you're closing the loop, and then as they get new data, they get more motivated. So that's why the people who have been written off, the obese, the diabetics, they've been written off by a lot of society and the doctors, because they're just like, I don't have the time in 10 minutes to teach you how to do this. So those are the people that are getting the most benefit, which is why we want those people in particular in our platform. So I'll just close that and then go back. So you also have, on the clinical dashboard, you have not only health alerts, but you have activity alerts. So you can see who didn't exercise, beyond 20 minutes. You can see who had less than 20,000 steps in a week, which you could argue is a sedentary individual, and you can send them messages. We also have nutrition alerts, and then you can also mass message, right? So if a population of 100,000, 5,000 of them didn't log nutrition, you can send out a message to the 5,000 people, say, hey, we didn't see any of your data this way, just log. So then you get that person to log, and all of a sudden now, the little dripping process adds up to a full bucket full of water. Right?
Well, I mean, it really looks fantastic. And I was an early player in the disease management industry, which, as you know, kind of didn't do so well over the last few years. But it's tools like this that I think are really going to change things. So I congratulate you on a wonderful product. I wish you luck on your consumer launch.
Thank you.
And I look forward to seeing the kind of results that come out of your collaboration with Harvard and other academic centers. Thank you, Samir.
Thank you.